everybody. Do you need a sound check? You all good? All right, good morning. My name is Greta Johnson, and I am the Director of Communications and Assistant Chief of Staff for the Summit County Executive's Office. On behalf of the Executive, we extend our sympathies to the family and friends of Mr. Walker, as well as to all members of the community who are struggling or overwhelmed by recent events. And I'm not going to let this platform go to waste, and I'm going to ask all of you who are here filming to help me amplify the message that there is help available for Summit County residents. If you're struggling right now or feel overwhelmed by the recent events, please reach out to our partners at 211. They will connect you with a mental health professional immediately. You've assembled today to hear from the Office of the Summit County Medical Examiner. The Medical Examiner is one of 9 departments within the Office of the Executive. The Medical Examiner's Office employs 3 full-time doctors and 16 additional staff. The Summit County Medical Examiner's Office is a fully accredited organization by the National Association of Medical Examiners. That represents the highest quality of death investigations. We're here at Summit County Public Health, who are not officially affiliated with the Summit County Medical Examiner's Office, but who were kind enough to host us this morning. The Medical Examiner's Office is independent from law enforcement agencies. The work completed by the Medical Examiner's Office is the documentation of autopsy findings and investigation of circumstances related to the cause and manner of death of an individual. During the course of the autopsy examination, evidence related to the cause and manner of death is collected and secured so that it is available for any potential future legal proceedings. The autopsy of Jayland Walker was performed by our Chief Deputy Medical Examiner, Dr. Robert Schott. The final report was created by Dr. Schott and contains the examination findings. Summit County's Chief Medical Examiner, Dr. Lisa Kohler, completed a quality control review of the report and then co-signed the report. The process of quality control report review takes place for all homicide deaths prior to the report being finalized. As it is with every investigation, the goal of the Summit County Medical Examiner's Office is to be able to provide an accurate assessment of the injuries sustained by Mr. Walker. The Ohio Revised Code is clear that the press is entitled to review the autopsy report, and as stated in our advisory, we have put into place a system by which members of the press can make an appointment to review the report. Because of the number of requests received even prior to the finalization of the report yesterday, it was clear that relaying this information to you in this manner was a more expeditious way of disseminating accurate information. Today you'll hear from our Chief Medical Examiner, Dr. Lisa Kohler, who will provide a summary of the injuries sustained by Mr. Walker, as well as some of the findings determined as a result of the autopsy. Dr. Kohler has been Summit County Chief Medical Examiner since 2001 and is Ohio's first female medical examiner. She received her Doctor of Medicine from the Medical College of Ohio at Toledo. She completed her pathology residency at the University of Pittsburgh Medical Center and completed her forensic pathology fellowship with the Chief Medical Examiner of Richmond, Virginia. She joined the Summit County Medical Examiner's Office in 1998. She is board certified in anatomic and clinical pathology and forensic pathology. In addition to her medical examiner duties, Dr. Kohler serves as an assistant professor of pathology at Northeastern Ohio University's College of Medicine. She is an expert witness in the states of Ohio, Pennsylvania, and Virginia. Her office again maintains full accreditation with the National Association of Medical Examiners. It is important to note the difference between a medical examiner and a coroner. The titles are not interchangeable. In Ohio, a coroner is an elected physician who is not required to possess professional training in pathology. A medical examiner, however, is appointed and has board certification in forensic pathology. All of our doctors are forensic pathologists who have undergone training specific to determining the cause and manner of death and the collection and preservation of evidence for use in legal proceedings. At this time, I will turn the podium over to Dr. Kohler.
Good morning. Thank you, Greta. I would also like to echo the executive's condolences to the family and friends of Jayland Walker. Mr. Walker's autopsy was completed by Dr. Schott on June 27th and 28th. Once the report was created by Dr. Schott, I then reviewed that report for quality control purposes and then co-signed that report on July 14th, 2022. The first part of the examination involves documenting identifying characteristics and noting medical therapies and injuries. Evidence of medical intervention on Mr. Walker included tourniquets on his legs and left arm, gauze dressings to his chest and abdominal wounds, adhesive seals over 2 chest wounds, and defibrillator pads on his chest. The autopsy determined that Jayland had 46 gunshot wound entrances or graze injuries. A graze injury results when the bullet runs along the surface of the skin but does not enter a specific area of the body. An entrance wound indicates that the bullet struck the skin and entered a part of the body and either exited or became lodged within tissues of the body. The photographic record shows more than 46 labeled wounds because there are exit wounds, bullets beneath the skin, and abrasions that were numbered for the purpose of identifying specific injuries in the photographs and to permit clarity. The injuries include the following: 15 gunshot wounds injured the torso and caused internal injury to his heart, lungs, liver, spleen, left kidney, intestines, and multiple ribs. 17 gunshot wounds injured the pelvis and upper legs, causing internal injury to the right iliac artery, which is a major artery going to the leg, the bladder, and fractures of the pelvis and both upper leg bones or femurs. 1 bullet struck the face and fractured the jaw. 8 gunshot wounds injured the arms and right hand. 5 gunshot wounds injured the knees, right lower leg, and right foot. His toxicology screen was negative for drugs of abuse and alcohol. Jayland Walker's death was due to blood loss from his internal injuries. The cause of death ruling was multiple gunshot wounds. The manner of death was ruled homicide, shot by others. Our ruling of homicide is a medical ruling, meaning death at the hands of another, and is not a legal conclusion. The choices that we have for manner of death are natural, indicating that the person is dying from natural disease, such as an infection, heart disease, or cancer. Accident, which would be due to an injury or poisoning that occurred without the intention to cause harm. Suicide is due to an injury or a poisoning that a person inflicted upon themselves with the intent to cause self-harm or death. Homicide signifies death at the hands of another, and undetermined is reserved for those times when 2 competing manners of death cannot be separated from one another based upon our examination and investigation. I understand questions have been raised about gunshot residue testing. First, allow me to explain what gunshot residue testing is and some additional information regarding this testing. Although the technology used to demonstrate the presence or absence of gunshot residues is sound, there are many factors that contribute to false positives and false negatives. Gunshot residue testing can detect specific particles related to the discharge of a firearm, but the results of that testing is not conclusive as to whether the person did or did not fire a weapon. These particles are very fine, and they are easily dislodged from the skin by acts as simple as putting your hands into your pockets or through the action of sweating. A positive test does not indicate that the person tested fired a weapon. And a negative test does not mean that the person tested did not fire a weapon or did not handle or was not in the vicinity of a recently fired weapon. The FBI lab discontinued gunshot residue testing in 2006. Based upon these issues related to the interpretation and testing and the ease with which these particles can be dislodged from the skin, the medical examiner's office discontinued collecting these samples in 2016 and no longer purchases the collection kits to be used by our staff. Because of this, Mr. Walker's hands were not swabbed or tested for gunshot residue. Upon my co-signing the report, members of the executive staff discussed the findings with Mr. Walker's family and representatives of the family were permitted to view the report prior to this media announcement. Thank you.
So as we move into the questions portion, I want you to note that upon the completion of the media event today, you will receive a press packet that includes a summary as detailed today by Dr. Kohler. So essentially written her statements. Additionally, you will receive Dr. Kohler's CV, Dr. Schott's CV, and again, a copy of the instructions on how to make an appointment to review the report. I want to take a minute and just change my hat from Director of Communications to Assistant Chief of Staff and publicly thank Dr. Kohler and her staff for their work, especially over the last couple of weeks. They have incredibly difficult jobs, and they handle them with unmatched professionalism and grace. And so that I ask you return that grace as we work to accommodate the request from you and your colleagues to review the report. We have dedicated additional staff from other departments to allow for more members of the media to have access simultaneously today. Again, those appointments will occur during regular medical examiner office hours. At this time, I'll field questions for Dr. Kohler. Please keep in mind that she cannot comment on the ongoing investigation, nor does she have any knowledge of their findings. Additionally, if your question calls for speculation, I'll change my hat again and put the attorney hat on, and she won't be answering those either. So Bob, we'll start with you.
Dr. Kohler, are you able to determine how many of those shots entered from the front or the back? In other words, how many times was he shot in the back while running away? Can you determine that, and if so, how do you figure that out?
Okay, as I mentioned before, we have the 46 entrance wounds or graze wounds. And as we're looking at it, there were 5 wounds that entered on the back surface of the body out of those 46. And I can't indicate whether or not that was during a time of running away or if that is just as the body turns as an individual is being shot and the rear portion of that individual is then facing the people firing. So I can't comment. You mentioned while he was running away, I don't know at what point those bullet wounds were inflicted.
So did 41 enter from the front then?
Yes, by the math, yes, front and sides.
Front.
And when we're describing those injuries, just for clarity, we describe all the injuries as though the person is standing in anatomic position. So they are upright, facing you, arms are down with palms forward. So any directions that we give are given as though the person is standing in that position because we do not know what position that body was in space at the time of the incident.
Phil?
Any exit wounds, number of exit wounds you could talk about?
Yes, with the 46 entrance wounds, there were 15 exit wounds. And I mentioned the graze wounds earlier, there were 5 graze wounds.
And can you talk about, are you able to determine how many shots entered the body while Mr. Walker was lying on the ground?
No, sir, I don't know the order of any of the wounds as to when they were inflicted, sir.
And what additional work do you have moving forward in this case in terms of the investigation?
We are waiting for final investigative information so that we can complete the investigation report. My investigator has to complete his report.
I understand.
Hold on, Bob.
Oh, sorry.
You mentioned that you're not able to determine which order the bullets hit his body, so therefore are you not able to determine which bullet actually killed him that led to his death?
That's correct. We are not able to say which bullet killed him. He had several very devastating injuries that would cause death. He's got an injury to his heart. He has injury to both lungs, which also bleed extensively, and he has an injury to the right iliac artery. So we've got multiple locations that are going to bleed significantly and would contribute to his death. I can't isolate one particular.
So about 4 bullets were main factors in that?
I don't even know how many bullets that would be. Those are the main organs and tissues that were injured that contribute to his blood loss and death.
Stephanie?
Your office didn't do a gunshot residue test. Are you aware of any other investigators did such a test?
We can't comment on any other investigation. Bob? Dave, sorry.
If, Dr. Kohler, you initially mentioned a tourniquet and some other bandages that were there. those could not have been placed on him himself. Are you able to say, are you able to address those and why they were there or who put those there?
Because we weren't at the scene at that time, I do not know who applied which medical therapies to him, just that that was what was present on his body when my investigator arrived at the scene.
But those would be consistent with at least some degree of effort to save his life, help him.
Yes, those are medical interventions with the goal of trying to preserve life.
Come back to Bob.
Doctor, I know you're not the police, but the issue with handcuffs, were the handcuffs on him when the autopsy was performed? And is that something that you have seen in the past where you have examined bodies that have come in still with handcuffs on?
Yes, there were handcuffs on his body at the time we received him. This is something that happens often enough that we do keep a handcuff key at the office to assist us in those situations.
Yes, sir.
I'm just reading the numbers here. You said 46 entrances are grazes, and you said 5 grazes. So can you confirm that means 41 entrances? And I believe you also said 15 exits. So can you confirm that the total number of wounds is, what, 61?
I don't do math on the fly. There are 46 entrance wounds. There are 15 exit wounds, and 5 of the wounds that would be in with the entrances are graze wounds.
Okay, thanks.
What kind of influence will your office's investigation have on, like, for example, BCIs or any other investigations going on? Are they all, completely separate results? How does one impact the other?
The autopsy report will be turned over to BCI, who is completing the investigation. At that point, Dr. Kohler and Dr. Schott will be available to discuss their findings with whomever BCI wants to follow up with them.
The report and the preliminary documents that we reviewed showed that a weapon was recovered in the car. I'm going to see the autopsy later, but are you able to say where in the car that the weapon was recovered?
The autopsy report does not reflect the positioning of the handgun that was retrieved from the vehicle. Dave?
So on that preliminary report, investigative report from the scene, there are also numerous photographs of projectiles, of spent bullets. And so it's my understanding that to count those up is an incorrect count of the number of projectiles that were discovered, because duplicate photos are taken by your department of the same projectile for reasons. Can you explain that, please?
Yes, when we recover projectiles from a body, we do photograph it before we package it for evidentiary purposes, and we typically take more than one view. Sometimes it's turning it from a different direction, but just making sure that we have good photo documentation. There are duplicate photographs taken.
So as a follow-up, so if there are 100 photographs of projectiles in that report, that doesn't mean that there were 100 projectiles recovered. Some of those are duplicate photos.
That's correct.
How many were recovered from the body?
26 bullets were recovered from the body.
So, simplicity's sake, just so I make sure that I understand this, is it fair to say that he was shot 46 times?
We have, as I mentioned, the 46 entrance wounds. Some of those wounds are on extremities. I can't say for certain whether wounds passed through an arm and then into the body or not. There is that possibility. So I can't say anything different than we've got 46 entrance/graze wounds.
And in your experience, from the many years you've been doing this, have you ever had occasion to have someone with that many gunshot wounds?
I don't recall what they've been over the course of the years.
And Bob, to be clear, because I ask Doc to break things down for me often, it is very possible that one bullet could cause several different entrance wounds. Stephanie?
Did your office, in the course of your investigation, investigation look at how many shots were fired in the general area, or was that not part of the scope?
With regards to the autopsy, it's separate from the number of shots fired. We don't have official reports that indicate that, so I don't know what the actual number of shots fired was or if that has been adequately determined as of yet.
Phil?
You said there were no drugs in Mr. Walker's system, no illegal drugs. Were there any prescribed medications in his system?
Our drug screen was negative for the drugs and alcohol that we tested for. We do not typically look for prescription drugs because that is just outside of our normal realm.
Any other questions?
Were there any prescription drugs that he was in his system that he was not prescribed?
She didn't test for those, Phil. It's not part of their normal battery of tests that they run. Anything else? All right, if you'll see my staff on your way out, they'll give you the press packet. Again, that includes a written statement from Dr. Kohler, as she described today, her CV, Dr. Schott's CV, and again, instructions on how to make an appointment to review the autopsy report at the medical examiner's office. Thank you for being here today.